Hello, Lauren Hubele here. I've got some advice for you today about how you might use gemmotherapy in your home with your family and loved ones in the case that symptoms of COVID-19 appear. And I want to give a note here for all listening that for the majority of you, you will be able to manage these symptoms at home. And it's very important that you don't resort to suppressing them in any way because you will have the symptoms linger longer and give a further imprint for chronic disease. If you, however, have respiratory diseases of any kind or pre-existing conditions that would be brought on or increased by COVID-19, then of course you'll be seeking medical care for your symptoms. But for the majority of us, we're going to be able to handle this at home. This is like a difficult flu, and the symptoms are ones that you will recognize easily with a headache and a tightness of chest and a dry cough. So what I'd like to do today is take you through which extracts I believe you should have on hand for your family. And my sense is right now, if everyone had one set of these extracts, they'd be able to manage the care for their family. So let's take a look right now at a presentation that I've prepared for you. So this is for the acute respiratory symptoms that are most commonly seen with COVID-19. And I want to start here with the dosage. And the general dosage guidelines are slightly different than if you've been working with me or another practitioner, because we're working with a little lower dosages. The reason being that we're sharing this information with people far and wide who may not be familiar with gemmotherapy, but also we're using several extracts, and the more extracts you use, the lower dose that you're going to be needing. So for this case right now, if you were to start treating someone in your family with symptoms, you'd find their age group here, and you'd use 1 to 3 drops if they were children under 5, always starting with the lower amount. If the results are achieved that you're looking for without any aggravations, then you want to continue at that dosage. If not, you can increase to the maximum dosage that I'm suggesting here per age group. You'll notice there's a drop in the dosage recommendations for those over 65 who tend to be more fragile when they experience these symptoms. So we want to start with lower doses and not push the body too hard. The numbers I'm recommending here are per dose, per extract. So when I'm suggesting 3 extracts, you would give that amount for each one in a small glass of water. So let's take a look. I've broken this protocol down to morning, midday, and evening, and then have a few post notes for you. The first thing that happens is right now, today, when we have a headache or we're exhausted, we all are pretty sure we've got COVID-19. Hopefully, for many of us, that's not going to be true. But there is something we should all do, whether we're sure this is it or we have no idea, and maybe we're just exhausted by all the changes in our life. What we're going to do is for the first 24 hours, we're going to dose black currant and oak. And we're going to dose black currant and oak because these are brilliant support systems for the adrenal glands. The adrenal glands are like the conductor of your immune response, and we want to give them all the help they need in those first 24 hours. I like to see these alternated, black currant 1 hour, oak the next, black currant the next hour. But if that just is too much for you to manage, given your lifestyle, you could certainly put them both together in a small glass of water and take it every 2 hours. Obviously, no one's going to need to be kept awake to do this. So if you fall asleep in the midst of this, that's great. Sleep, because sleep is one of the best things you could be doing for your immune response right now. Then here comes the morning that you have the first respiratory symptoms. And they generally come with a tightness of chest, could come with a dry cough already. So what are you going to be taking? You're going to be taking our tried and true protocol for bronchitis, bronchial inflammation, and any viruses with a cough. And that's going to be common alder, blackcurrant, and hornbeam in the dosage that would be best matched for your age group. And you're going to take that in a small glass of water, and then you're going to take separately, right on your tongue, 1 drop of silver lime. Why the silver lime? What we're trying to do here is we're trying to harmonize the nervous system. This is super important and very different than you're used to doing if you've worked with any of mine acute protocols. With this virus, and actually with any deep acting virus, we want to keep the communication systems flowing in the body. And the communications that go from your brain to the organ can easily get disrupted when we are in a fight or flight state, which we're all walking around in right now, unfortunately. So what I want you to do is you're taking that 1 drop of silver lime to help support the communication between your brain and your respiratory tract. Midday. Now I'm going to give you some choices here. What we're trying to do midday is work with extracts that help move that inflammation along. And I have several choices. The reason I'm giving you choices is I'm not sure whether we're going to be able to provide all of these for you throughout the whole length of this virus. We're doing our best to get in supplies, and all of them are good. So let me talk you through them. So what we're trying to do here is we're trying to work with the lymphatic system and circulation, and we're trying to help with the fluidity of this inflammation, moving it, right? Because there's a lot of congestion, deep congestion. That's why the symptoms linger. And they linger further if you're suppressing them with over-the-counter medications. So we want to help move them instead. I want to recommend to you one of the chestnut extracts, sweet chestnut or horse chestnut, as a first choice to consider. It would be taken with black currant. You don't need both sweet chestnut and horse chestnut, only one. And one will do the trick that you're looking for if you add it with the 1 drop of silver lime. So just like you did in the morning, you're going to take the sweet chestnut or horse chestnut in a glass of water with black currant, and then you're going to take the 1 drop of silver lime right on your tongue to keep harmonizing that nervous system. Now, what else do we have that could be on equally good? Well, if there's any smokers involved in this, you need privet. And I would use privet instead of the chestnuts. Privet works particularly with the mucosal linings, which are all disrupted by cigarette smoke or marijuana smoke. So you want to use privet as your choice for any smokers that you'll be treating with COVID-19. Then we have a third extract I want to offer to you if the person that you're treating is over 25 and is not allergic to aspirin. And this is black poplar. This is a deep acting extract, and you would go to it if your sweet chestnut or your horse chestnut isn't giving you the effect that you want, moving this respiration, this inflammation in the respiratory tract along. And black poplar is deep acting, working with circulation, helping with the fluidity of the blood, and helping with resolving inflammation right in the respiratory tract. Now we come to evening, and the job of the protocol in the evening is to bring about some restful sleep. And one of the reasons we're woken often in the night when we have a respiratory illness is because the lungs are cleaning at night. And when they're cleaning, they're inflamed, like ours would be, it causes a light sleep and a sleep that we are not allowed to go into deeply. We're often interrupted with coughing. So we're going to do 2 things. We're going to pick 2 extracts here. And the first extract we're going to pick is going to resolve the inflammation in the lungs, address specifically the bronchi in the lungs. And I've got 4 to choose from. You're only going to need to pick 1. And the first one would be hazel. If the challenge is in-breath and out-breath, it's restricted. getting the in-breath and out-breath in. We need to restore elasticity to the connective tissue in the lungs. That would be hazel. If we're being disrupted with cough and coughs that are sent to the message is being sent and it's not necessarily a true message, it's a false message. You don't really need to cough. There's not anything to cough up. That would be hornbeam. And that will help with the brain center and the message it sends to the respiratory tract in giving you a quiet sleep. If there's a thick mucus in the back of the throat that needs to be thinned to help with breathing, we're talking about fluidity again of phlegm or mucus, then black honeysuckle would be your choice. And then finally, if you are someone or the person you're treating has asthma or a tendency for asthma, Lethargy may be your best choice there. And they're struggling with breath and they may have the type of cough that is familiar with Lethargy, or excuse me, with asthma, where they have a repetitive cough. Now, what are we going to put with this? We're going to put something for the nervous system that's going to help settle the nervous system so we can sleep, and also help again with the communication from the brain to the respiratory tract. And here are my favorite ones. And I want you to pick it based on what's going on with the person you're treating or if this is yourself. It's going to be black honeysuckle if there is any mild depression that's coming on with this. And you'll notice that I already talked about black honeysuckle in a full dose. This is a microdose. This is 1 drop only, maybe 2 for the nervous system. And you cannot use the same extract in a full dose as you are microdosing, okay? So if you pick black honeysuckle for your first extract in a full dose, you're not gonna be able to choose it here. Then if you are having a lot of ruminating thoughts, if that's the issue, and getting to sleep and not being able to fall asleep until after 1 a.m., that would be field maple. Another indication for field maple would be an irritability, and particularly in someone that's not typically irritable. If the person we're treating has nervous palpitations that have come on with this, and difficult settling into sleep because of the nervous palpitations, or a grief about it all, hawthorn would be your extract. Again, only 1 drop. You can go up to 2, but 1 is generally enough here. If sleep just eludes you, 100% cannot get to sleep at all, white willow is your answer. White willow helps harmonize the parasympathetic and sympathetic state and is a good sedating extract, helping bring sleep. Then if anxious breathing is an issue, it would be Lethargy. And finally, for the person that can't quite get themselves to bed, they have to do one more thing before they go to bed. And this may be the caregiver of the household. There's always one more thing that has to be fixed, one more thing that has to be prepared, and they can't quite surrender to sleep for the evening. Hazel would be the choice. Now I want to remind you, in the evening, we're going to take 2 different extracts, 1 in a full dose, and that's from that first list, hazel, hornbeam, black honeysuckle, or Lethargy, and then 1 as a microdose, just tapping into the nervous system. And it will be from the bottom list, black honeysuckle, field maple, hawthorn, white willow, Lethargy, or hazel. You cannot give the same extract in a full dose during the day and also in a microdose. So please keep that in mind as you're building a protocol for the people you're caring for. Now, some extra considerations. One of the things we're hearing about with patients with COVID-19 is a lot of lethargy, an inability to sit up even, hold their upper torso up. We have excellent Gemmos for that, and they would be microdosed, 1 or 2 drops. And I would give those just once a day, and you could look to redwood. Redwood would be particularly good for caregivers that still have to keep going on in the face of their symptoms. Perhaps if the whole family's sick and a parent is taking care of children that are ill and must go on, giant redwood would be a very good choice. Oak is another good choice for that complete exhaustion. You don't have to have both in your household. Maybe you already have one, use that one. Then we have some people that are going to be in really fragile states, whether that's fragile emotionally or fragile physically by this. And they would be in that state of lethargy, but super fragile. And this happens a lot with older people. And older people that have been able to see this through at home, that haven't had to be hospitalized. Dog Rose helps restore their strength and vitality and move them from that fragile state. Again, I would do this in microdoses, 1 to 2 drops. It could also be they're fragile emotionally and they just feel like any little touch and they're going to fall apart emotionally. And maybe that's you right now. Dog Rose would be a great recommendation, even if you don't have COVID-19. Now, moisture managers. This is just a word about these, and so you know why these are in these protocols. You'll see that I use things like common alder, hazel, and black poplar in my protocol. These are harmonizers for our moisture in our body. They're not necessarily drying up, but they're managing it, and they're all very effective. And one of the symptoms you probably heard about with COVID-19 is this feeling of drowning or this fluid that we can't move. And that's exactly why those are in the protocol. And then I want to remind you, don't leave out this nervous system extract. It may seem like not a big deal. It's just 1 drop, right? That 1 drop is super powerful. And keeping your body's ability to communicate within the systems, it's going to be essential in helping you regain your strength quicker and be back to your normal life. So we want to optimize communication with the systems. And then I want to carry on here for a minute about extracts that restore strength. If you are coming out of this, and good for you, you did it, you made it, you survived COVID-19, and now your immunity is just great because you've done nothing but good things, I'm sure, through this process. I want you to consider each morning a microdose of any of these extracts, and it could be 2. You might find 2 that you really like. Giant redwood, as we talked about, this helps with this upright strength and the ability to keep going in the face of challenges. Oak for that complete lethargy and also some mild depression. Sea buckthorn to help restore our clarity and focus in our head and creativity. We all want that to be coming back online. And silver birch seed, again, for focus and stamina and forward moving momentum. So you might choose one of these, you might choose 1 or 2, and they would be good to be on hand for anyone as they're restoring strength from this virus. And it may be we all need to, even if we don't get this virus, right? Then what about restoring strength midday? We have 2 really excellent extracts that I would really love to see people go on for 30 days after they are having the virus. And if you're under 40, all the way down to 6 years old, then silver birch buds would be your extract. If you're over 40, it would be common birch. Both of those would be taken together with the extract black currant. And I highly recommend this. This is so important because you need to restore your body after this virus, and you will be even stronger in the face of viruses and flus to come in future years. And then finally, let's talk about restoring strength in the evening. We're going to use that trusted hazel that's got us through all stages of this virus. And we're going to add 1 drop of lithy just to help the lungs. And I would recommend this full protocol, something in the morning, that one of those microdose, 1 or 2 drops, the birch, whichever one fits you, midday, and 1 drop of lithy along with hazel in the evening. I would recommend these for a good 30-day period following this virus. So that's what I have for you as far as protocol. Now, I just want to tell you, you've got this. You can totally get yourself through this. And you were born to be your own healer. I know that. You have everything you need right inside you, and you have to believe in yourself and your ability to do this. Having said that, if you have compromised immunity and you have complicated diseases, you're going to need other help. And I get that. And we have medical systems in place. But if that's not you, take this on. You can manage it. And we've got good tools in place for you. Thank you. And I wish you all the best as we work our way through this virus.